forward. You see those little guys from Russia? Do you see those big guys from out west Nebraska? Their shoulders are forward. Why do you think they're forward? Why? Because it helps them elevate. Their ribs are down, their shoulders come up, so it helps them elevate to do one word: breathe, as they are in a state of extension. So before you tell me I'm going to move their head back, strengthen their abdomen. Remember those forward head posture days and those posterior craniums? Before you would do that, I would say, please twist the levator. Please twist the levator. Please get the neck and the thorax in a position where the levator is staying what? Twisted. Because if it stays twisted now, it's elevating a scapula. It's not elevating a rib cage, which is what it was meant to do. It was also meant to be a rotator of the neck. How are you going to rotate your neck when you took all the torque out of the levator? The neck can't rotate right now. It's going to stay axially what? Stiff. So we have a test called cervical axial rotation test. If the neck can't turn and it can't twist, I'm going to say to you, Jonathan, please twist the levator scapula. Please get the shoulder blade to come down. Please get the rib cage to come up. Please start with the rib cage. Please start with Rick. And you'll find that you don't have a huge neck problem. Neck moves fine. Why are you putting all the attention on the neck? I hope this is making some sense. Is that making some sense? So that's a cool muscle. That is a cool muscle. Please look at it and ask yourself, what do you think yours is doing? Okay, we'll get through this. We'll take a break. Upper traps, basically you know where they go. They raise. Can you circle that, page 11? How many times have you circled the word raise today? It's by design. When you use your upper traps to raise something, you're gonna be challenged with that ventilatory activity. So you raise it. It goes to the occiput, down to the lateral clavicle. Here's the thing that, could you underline this please, everybody? Border of the lateral clavicle. Does anybody see the word scapula on this handout? I'm always amazed how many people will tell me that the upper trap attaches to the scapula. Folks, can you please write this down? In red colors, red letters, bold letters, the upper trapezius does not attach to the shoulder blade. Could you just do it? Please chew on it for a few weeks, maybe a couple of years. It does not attach to your shoulder blade. So you know you look foolish when you say to me, Tyler, the upper trap is pulling the shoulders up. No. The upper trap does not attach to your shoulder blade. The upper trap attaches to the collarbone. Collarbone. What comes off the bottom of that collarbone right here to the first rib? So the subclavius and the upper trap work together to draw air in. Don't look foolish. Upper traps do not elevate your shoulder blade. They indirectly assist in elevation of the shoulder blade through what bone? The clavicle. And go back to the anatomy and please underline clavicle. They don't go to, the upper trap does not go to the shoulder blade. The deltoid comes right off the clavicle. The upper trap is directly opposed by the anterior part of the deltoid. There it is. And right behind that deltoid, next to that deltoid, is a muscle called the subclavius. Now you're starting to understand a chain. What's that chain called? What's the tab called? Now you're getting the brachial chain. Now you're understanding the brachial chain is responsible for expansion. If you don't have a lung or a tire that's fully got 35 pounds of square inch PSI in it for pressure, these muscles, Heather, will help you get it. Even when you don't feel it, they're constantly elevating and lifting. The anterior deltoid, coracle brachialis, the clavicular section of the pecs, the subscapularis, the head of the bicep brachii, all assist with upper trap accessory respiratory function. And the last muscle is the sternocleidomastoid. Goes from the sternum to the temporal bone. The mastoid is your temporal bone. Can you circle this word on page 11? Can you circle this word? Raises. Raises the chin to the opposite side, bends the head forward, elevates the chin. This is a major muscle when it comes to integrating cranium with the brachial chain. It gets into the other course called temporal mandibular cervical cranial chain. I think we're going to stop there. This is all the break. So it's now about 10 after. We got some pecs to talk about, then we're going to get right into some testing. Thanks for being attentive this morning. Is there anybody dying to ask a question right now? Is there any questions at all? Yes, Sonia. Don't die over it. I want you to ask questions. Yes.
Did you just say the deltoid opposes the upper trap and the
And right by it is the subclavius. So you have, when you look at the deltoid, and Sonia, I'm going over this a little fast, but if you go back to the anterior deltoid comes off the bottom of the collarbone. Anterior deltoid comes off the collarbone under surface. And right next to it is this. See it? And you know, if I could, I'd put you all back in the anatomy lab and we'd look at it right now. Because the subclavius and the anterior deltoid are polyarticular muscles. What does the word polyarticular mean? Where one starts, the other one ends. Where one ends, the other one starts. So the anterior deltoid is going all the way across your chest. It's part of your brachial chain. And what do those two muscles do to the collarbone? Rotate it down. What pulls it up? Upper trap. What else pulls it up? Sternocleidomastoid. What also pulls it up? Trick question. Scalenes. So you got a nice little stable system going on here, Stephanie. If I really want to draw like that architect yesterday did, a straight line without a ruler, would I do this or would I do that? If I really want fine distal motor control, would I do that? Would I do this? I would do this. Because if I do this, I just anchored my scapula. I anchored my chest. I raised and compressed. And I can do things that are unbelievable. And then if you ask me to do this, my vision's a mess. I'm a little lightheaded. I'm a little dizzy. I'm a little unstable. And I can't breathe. Because Rick, what do I don't have when I do that? Thank you. From this unbelievable rib hump that I just developed. I'm a clinician. What good is it to teach anatomy if you can't apply it in the real world? Do you follow me? What good is that? You have a textbook in anatomy, go look at it. I haven't given you anything that you don't know. Maybe you didn't know it. But what does it really mean? What does it really mean when you're trying to get somebody to do something better in a better position? Hopefully you're getting that. Any other questions at all? Let's take about a 10-minute break, okay? 10-minute break.